Everyone, my name is Samantha Bevins. I am Sarah Hoyt's daughter. I am also a 21-year-old government student at Dartmouth College, legislative director for Social Impact Partners, co-chair of the Social Impact Partners Youth Board, and captain of the Dartmouth Innovation Olympics team. I'm honored to be speaking for all of you today at such an important event, and I am very sad to not be there in person as I am currently studying abroad in London. Brain health and healthy aging are deeply personal topics for me and my family. Just over a year ago today, I lost my father, Scott Bevins, who was my very best friend. We lost him to early onset dementia. In honor of my father, my brother, my mom, and I will not stop fighting for solutions and improvements to brain health, healthy aging, and dementia until no one has to experience the pain that my father went through. It's also important when talking about finding solutions and preventative measures for dementia and neurodegenerative diseases that we use inclusive language, because Alzheimer's is just one of many different kinds of dementia. For example, my father had Lewy body dementia, not Alzheimer's. This past summer, I was lucky to serve as captain for the Dartmouth College team in the Innovation Olympics. I want to give a huge shout out to my amazing teammates, which includes my brother Wesley Bevins, Leela Ambrose, Vedant Tapievala, and 3 people in the audience today. Please stand up: Gabby Novak, Megan Lynch, and Julia Papanasto. Our team decided to focus on food as medicine for our topic in the consulting and innovation competition, because eating brain healthy food is just one of many preventive measures people can take to lower their risk of having a neurodegenerative disease. But we wanted to focus on food because it's something people consume every single day. And with greater awareness and financial support from the government to access nutritional food, people can shift their nutritional habits to lower the risk of having dementia when they're older. When people think of healthy aging, brain health, or dementia, their minds shift to thinking about an older population. But dementia does not just affect the elderly. Actions taken throughout your whole life impact your longevity. My dad was taken far too young, and he began his battle with early onset dementia in his 50s. Early onset or younger onset dementia is defined as people who develop Alzheimer's or any dementia before the age of 65. People can get diagnosed in their 60s, 50s, 40s, and 30s. This is why it's so important that we start thinking about what we're eating and preventive measures we can take at a young age, like myself, college students, and even younger. So the reason why I wanted our team to work with Sodexo is because it's important to recognize that healthy aging starts at an even younger age than myself. And Sodexo has a wide client range of all ages for their food distribution, which allows Sodexo's brain healthy diet to benefit people of all ages. We worked with Sodexo and interviewed multiple members of their executive team, including working with Pietro and Mindy. Our work focused on a marketing strategy for Sodexo to use for its clients to buy into a new brain healthy diet based on the MIND trial. The MIND trial is something that I've been studying since my father was sick. So when I heard Sodexo's commitment and excitement to work with the MIND trial diet, I knew working with them would be a good idea for our Innovation Olympics team. This topic is obviously something I'm very passionate about because it's important to work to spread awareness about the impact each person can have on their probability of having a neurodegenerative disease later in life based on their nutrition. Our final consulting plan for Sodexo was a marketing strategy of an app where someone in their family, friends, or caretakers can keep track and help log their own or someone else's nutrition each week in relation to brain healthy food and the MIND trial diet. This idea of centrally tracking brain healthy food inputs each week would be useful for all target ages and customers for Sodexo, because it's important to track personal progress. And it's equally important for college students like myself and seniors in senior living communities to have brain healthy food. It's extremely important to continue to build public awareness about the importance of nutrition. It's also important to recognize that there is an obvious inequality in America of who can access healthy foods. And people with a lower socioeconomic status need the government to help make it easier to consume brain healthy foods. Currently, according to Alzheimer's Association, people with a lower socioeconomic status have a higher risk of developing dementia and having faster memory decline, which is partly due to an inhibited ability to afford brain healthy and nutritional food. This is why policies like Senator Booker's SNAP Nutrition Security Act and Senator Gillibrand's strategic plans on aging are so important, because they help make nutritious food available and affordable to more Americans. Collaboration between the government, for-profit, and nonprofit sectors is necessary to make forward progress towards increasing brain health and decreasing the number of people with neurodegenerative diseases. I am very grateful to everyone who gathered here today to make an impact and spread awareness about the important steps that can be taken for brain health and healthy aging. And I'm particularly grateful for Sodexo for being able to work with your team and have our Dartmouth Innovation team work with all of you guys. It means so much to me and my family. In honor of my dad, I will not stop fighting until no one has to go through the pain and long goodbye that my father had to. Thank you all again. And most importantly, thank you, Dad, for being the greatest man I have ever known and ever will know. As he would always say, I love you forever and a day. Dad, I love you forever and a day. Everything I do will always be in honor of him, and I will keep fighting for preventative measures and solutions to dementia and neurodegenerative diseases in honor of him. Thank you.